Assalamu alaikum everyone. My name is Dr. Aqsa Ghauri. I'm a lecturer in the Department of Anatomy at Dow International Dental College. I, along with my peer and my students, conducted a research on the impact of peer support and academic environment on students' mental well-being. The research focuses on the importance of strengthening academic environments and peer support systems to enhance mental well being among medical and dental students, an issue of growing global concern in health professional education. Medical and dental education is widely recognized as academically demanding, emotionally intense, and psychologically challenging. Students are required to manage heavy workloads, frequent assessments, long clinical hours, and high expectations, often within competitive environments. Numerous international studies have demonstrated elevated levels of stress, anxiety, burnout, and depression among healthcare students compared to the general population. If left unaddressed, these mental health challenges not only affect academic performance but can also compromise empathy, professionalism, and future patient care. This highlights the urgent need for institutional strategies that promote psychological resilience and supportive learning environment. As healthcare professionals and students, we often talk about stress, workload, and burnout. But when we look closely, you realize that two things make huge difference in how we cope: the people around us and the environment that we study in. Supportive peers can make tough days manageable, and a healthy academic climate can motivate us instead of overwhelming us. Despite how important these factors are, there isn't much local evidence, especially among BDS and MBBS students, that clearly shows how they influence mental well being. So that's the gap our study aimed to explore. Coming towards the objectives, we focused on two simple questions. Number one, do peer support and academic environment influence mental well being? And number two, how strongly these factors related among medical and dental students at DOHS? To explore this, we conducted a 6 month cross sectional study with 236 students. Data was collected through an anonymous Google form, and we analyzed the results using SPSS. Of course, the study had its limitations. It's cross sectional, so it cannot prove causation, and it was conducted within one institute. But it still gives us a clear picture of what's happening among our student community. We analyzed the data from 236 participants using SPSS. Descriptive statistics were computed to summarize the key variables. Mental well being showed a lower mean compared to academic environment and peer support, which were both moderate. Pearson correlation was used to assess the relationship among variables, and linear regression was conducted to examine whether academic environment and peer support significantly predict mental well being. The results were actually quite striking. Both the academic environment and peer support showed moderate positive correlations with mental well being. These findings suggest that improvements in both academic structures and peer support systems are important for enhancing students' mental well being. This means that students who felt supported academically and socially also reported better mental well being, and relationship wasn't just minor, it was substantial. When we ran the regression analysis, we saw that these two factors together explained the 32.3% of the variation in mental well being. In simpler words, almost one third of how mentally well a student feels can be linked to their academic climate and their peers. Coming towards the conclusion, our findings suggest that students' mental well being is influenced by multiple institutional factors, with the academic environment and peer support playing central role. The study provides evidence to inform policy, program development, and curriculum design, while also offering measurable indicators for monitoring well being over time. Practically, the results support a multi level institutional strategy focused on improving academic climates, strengthening teaching practices, and expanding peer based support system. So, what does all this means? It means that improving students' mental health does not always require complicated interventions. Sometimes creating a more supportive academic culture and strengthening peer relationships can make a meaningful difference. Now, I would like to thank you all for your time and attention. And as healthcare professionals, we are excellent at looking after others, sometimes less so at looking after ourselves. So I'll end with a simple reminder: protect our mental health, protect your mental health as carefully as you protect your patients. Thank you.